There's no doubt that a fully booked schedule is a good thing when it comes to increasing your revenue and cycling through that long patient wait list. But one thing is certain, more patient treatments means more time finalizing your charts. Clinical documentation is often a time-consuming chore left at the end of the day, and it may feel like a whole second job. Most clinics offer a curated set of services that are routinely performed day to day, which means most chart notes are very similar from one patient to the next. With that in mind, we've created a workflow automation tool to help you significantly minimize the time that you spend typing the same notes over and over. With Predictive Notes, you can build a dot phrase that can be easily added to any chart. You create one fully documented, robust chart note for a given procedure and save it as your note template. When a patient comes in for that service, you can find and insert that chart note by simply typing in a dot and selecting the predefined abbreviation from the dot phrases menu. At that point, you can add things like unit counts or mLs to customize the predictive note for that particular treatment and that patient. This saves you valuable time and eliminates the need for all that typing. It's also a great way to add routine information to every chart, such as referencing a previously completed good faith exam, documenting your review of the patient's questionnaire, or explaining post-care instructions. You have the ability to create a dot phrase for anything you need, and you can still add specific notes as well. It's all saved to the patient's procedure and available in the document repository. Another workflow automation tool at your disposal is treatment templates. For those more medical-based procedures that are stepwise or have multiple required fields or responses, treatment templates are a great place to start. These templates break the procedure into a questionnaire where the provider can answer things like yes, no, multiple choice, radial buttons, free text, upload a file, or an opinion scale. A great example would be administering an IV. You're required to take both vitals pre- and post-procedure. You can begin the template with your pre-procedure vitals, leave the template, complete other tasks, and then come back and pick up exactly where you left off to enter your post-vitals. Now both pre and post are identically structured and nothing gets lost. The same logic can be applied to weight loss patients who are taking routine measurements and want to compare a quick reference guide to see progress over last time. These are also a great tool for good faith exams. You can add a list of patient concerns that can be easily checked off, as well as a menu of services for approval. The provider conducting the GFE can check off the services approved for that patient and add any additional information via notes. These templates are all stored in the document repository, much like a questionnaire, so it can be recalled with a simple search. This is especially helpful in the case of a GFE, if the provider wants to double-check the approved services and by whom without having to find the original procedure. The timestamp is clearly visible, so you can ensure it's up to date at a glance. In addition, they're also attached to the procedure so the original medical record stays complete. In either case, a complete chart is a critical step for ensuring compliance with any medical, nursing, or pharmacy board regulations. And although it's a necessity, that doesn't make the workload seem any easier. Using automated workflow tools like Predictive Notes and treatment templates can cut your charting time in half and keep you running at full speed, all in record time.